So we're going to start a press conference, this report to the students, faculty, and staff, and the public in San Francisco. My name is Steve Zeltzer. I'm with the Higher Education Action Team. I'm also with Workweek and United Front Committee for a Labor Party. So this is a day when people should be getting registered, finding out, and right today people are asking us why the doors are locked, why there's no information about what's happening, as well as how to protect yourself in the midst of a terrible COVID pandemic. And so he has called this press conference today to address some of those issues, to make sure that the students, faculty, and staff are protected, and what the problems are that we face here. So we have a number of speakers that we're going to have. And the first one is Madeline Mueller, who's the chair of the music department. Welcome, Madeline Mueller.
This is my first time wearing the N95, which is highly recommended. And I'm going to read something that another faculty member put out about these masks, because I'm going to recommend definitely, according to the latest research, that these N95s are very much more effective, especially if you're not vaccinated or in a mix with people, even if you are and they aren't, etc. So for areas like this where we have a gathering, I'm going to start wearing the N95, which I'm not used to yet. I found out, for example, that N stands for National Institute for Occupational Safety and Health. How's that? And the 95, and this is interesting, refers to the fact that it's designed to block at least 95% of particulate matter. So it really is much more effective than what we would wear in different environments that need quite this efficiency. Now, there are other possibilities. This particular mask goes over the head, which I'm not used to, but they say that you can also find a KF95 or a 94, which goes over the ears and is a little more comfortable. And then there is the KN95s, which come from China, but sometimes are not exactly up to stuff. So this is something to look into as we return to campus. If there is no vaccination, and there's a month now or so to catch up to that, then I very much will recommend that people wear this most efficient, uncomfortable, but necessary mask. And I have some extras here, and after I speak, I'll ask those gathered if they would like a version of N95 to wear. The other thing I came today for people gathered with 3 handout sheets. I'm very old-fashioned about such things, because sometimes what's online isn't absolutely up to date. So we have a very moving situation at City College with things happening within the last couple of days about the vaccine. There's the board. Let's see if I have it here. Yes. Behind here. There we go. The board, would somebody get that first handout sheet for me? Over here. Just the first one. Yeah, I just want to show, this is an update that came, and we'll have a later speaker about this, came from our trustees meeting last Thursday. There's a resolution that they were able to pass, which will mandate now a vaccine requirement for City College. There are a lot of details in it, and those of you here, I have extra copies for you. So far, the detailed version hasn't gone online yet, so you'll be the first to get that. And you'll also have the update of the press release that the group who is sponsoring this event, this video, sent out preceding the board agenda. And that too will be helpful information, I hope, to those of you gathered here. And after I speak, I'll hand it out. And then I found a copy of an update to, I think it's August 3rd, coming from the San Francisco Department of Health that has a lot of good detail. Now here's where City College has to really get going in the next weeks. with the detail. You know, what is it? The devil's in the detail. We've got to get the detail, especially about the vaccination part of things, that not just City College, but I think we're up to 26 or so of the community colleges that have very recently put out a vaccine mandate. Some of them also have October 1st as a kind of stepping deadline, but that's the ultimate deadline. But getting to there, the administration will work with them, the board will work with them, everybody's working together on this one to make sure that everybody's safe. And while those details for the vaccination are worked out, we'll wear our masks. And I'm also on the college's facilities committee. We will be meeting next Monday, and we'll try to get a really good update on what is happening building by building. The campus has older buildings. The HVAC systems are different than other schools. We've got to get this all up to snuff. I'm a department chair, and the department chairs are working discipline by discipline to open up safely those areas that are really necessary as soon as possible, lab areas, that kind of thing, especially lab areas where health issues are concerned, the nursing, biology, those kinds of things. So everybody's working very hard. And I think that's enough for me, and I'm going to leave the microphone and pass these things around.
Other universities, and for example, Stanford and others, are giving information out, education out to the students. They're also preparing testing, mass testing. You would think after over a year of this pandemic, there would be testing available for people to know if other people have it, if you have it. There is no plans for testing here at San Francisco City College, which I think is really negligent to send people back to this campus and other campuses without testing, allowing for testing, which is being done at Stanford for all the students and faculty and staff. And we demand that that testing be available here for anybody who comes back on this campus. So our next speaker is Rick Baum, who's John Rizzo, who's a member of the Board of Trustees, and introduced this resolution to mandate vaccination, which only came about actually after he introduced our statement demanding it. So welcome, John Rizzo.
Thank you. I had actually been pushing for a vaccine mandate for City College for about 3 months, and hammering on the administration and watching the San Francisco COVID numbers increase by triple digits, every day. That was happening this summer, but we finally got it on the agenda. And our concern is this Delta variant. We don't even know the implications of the Delta. We don't know what the long-term health effects are. We know it's affecting children, which last year's COVID did not affect children. We have children in ICUs now, and this is serious, deadly stuff. And our number one priority has to be at City College to have a space that is safe and healthy for everyone who's in it, the students and the people who work here. So for me, it was a no-brainer that we should have a vaccine mandate. There is an answer to this deadly disease, and that's the vaccine. And if enough people would take it, we would be through with this pandemic, this awful pandemic. The economy is not going to improve until the pandemic is gone, and the vaccine is the answer. So we're hoping that in the next 4 to 6 weeks, the administration, what we tasked the administration to do was to work with the constituent groups to come up with a plan on how to implement the vaccine mandate. And so the details of where people will show their proof of ID and that have not been worked out yet, but we hope that it does. As far as testing goes, I am a big supporter of testing as well, and I do think testing should be part of the plan that comes out, and I'm going to be advocating for that as well. But we have something like 28% of our classes this semester starting in person. That's not a lot, but it's still a lot of people that potentially in harm's way. And we need to show people, if they're reluctant to get the vaccine, we need to show them information. We need to get them to talk to people who they trust, who can give them the right information, because this is a matter of life and death, and there's nothing more important than that. So, thank you.
Thanks everyone who's here today. Can I be heard okay through my N95 mask? Am I heard okay? Okay, because I want to keep it on this mic. Okay, there I go. Anyways, he has called this press conference today. We're the Higher Education Action Team, because we're concerned not only about the health and well-being of students, staff, and faculty at this college, but the greater community. Because as we know, COVID-19 is a disease that is easily spread by people, and that's why vaccinating everyone, not just in the United States, but the whole world, is so critical if we're going to get rid ourselves of this disease. As far as we're concerned, those in charge at City College of San Francisco have not taken timely steps to protect people's health, and certainly they cannot stop the spread of COVID, but at a minimum, as is being done elsewhere, there's no excuse for them to not already have in place a number of steps that they could have taken the last 3 or 4 months that have been taken at hundreds of other colleges. They're way behind on the 8 ball. And they include things like a vaccine mandate, which supposedly will be in effect soon, a masking requirement. They already have that in effect. That's on their website. But today, I walked around the campus, and there's no signs telling people that they have to wear a mask when they're on campus, whether they're outdoors or indoors, and whether or not they're vaccinated. How could they not have signs up informing people that they have to be wearing masks? I mean, it's like it defeats the purpose of having that requirement if you aren't even going to have signs around the campus calling for that. And as I walked around, there's very few people here, but I saw many people that were unmasked. That's not going to stop the spread of COVID. We also are very concerned about proper ventilation in all of the buildings, not only the buildings, the classrooms, the offices, the hallways, and the restrooms. And we have not been given very much information about what they're doing to accomplish this. We have heard anecdotal stories about windows not being open, that mold in the buildings, and things to that effect. You would think that the leaders would be informing us about this. They will tell us that they're very focused on the safety of students and employees, but their actions do not match their words. And this is what happens over and over again. They say the right things, but what they do is often quite contrary to that. As far as the vaccination mandate is concerned, only on Thursday, August 12th, did the board finally pass a resolution calling for a vaccine mandate. That's weeks after it was done again at hundreds of other colleges. Furthermore, back in May, the State Community College Chancellor's General Counsel stated that they had the legal authority to impose a vaccine mandate at that time. So they had the legal authority from the state chancellor saying that they could require vaccination, and of course, they didn't do so until August 12th, and then it's not going to be put in effect until October 1st. So to me, that's irresponsible. We are not being informed to exactly what they're doing about ventilation. I've already mentioned that. Certainly we could use an independent industrial hygienist to certify that the buildings are safe for people to be in them from 1 to 3, 4 hours at a time. But we are not informed if any of that's being done. Now the other thing is, who are the students at City College? Many of them lack proper access to health care in our society. They're the people who have disproportionately suffered from COVID and the pandemic. They're predominantly working class and lower middle class people of color. Many of them and their families are essential workers. I want to stress this. We're always celebrating essential workers. Well, who do you think they are? Many of them are our students and their family members. And yet, their health and safety is not being protected by those who are in charge at this college. So I would say that City College should be doing at least as much as they're doing at Stanford, as Steve has already mentioned. And there at Stanford, you have a different group of people. Many of them are very well-to-do, and generally they've been less adversely affected by COVID. So if anything, this school should be ahead of the pack. It should be ahead of what a school like Stanford is doing, given the negative impacts that people have endured during this pandemic and who those people are. Again, there's predominantly or disproportionately people of color and working class people and essential workers. And that's the type of people who attend this college. The serious shortcomings in the policies of the leaders at City College comes as no surprise. I mean, it doesn't surprise me if you've been following their policies and what they've been doing in terms of their cuts. Back in February, they were proposing, and this was approved by the board, making tremendous cuts in classes. Among the programs and classes they were cutting or reducing was in health education programs and in the nursing program. Think about that, the nursing program. What on earth are they doing dismantling or cutting back a nursing program when we know there's a nursing shortage in the middle of a pandemic? They're putting our lives at risk at some point in the future, because I actually have been treated by a student, ex-student of mine who became a nurse when I went to Kaiser one day. And we're dependent on those people. And what are the people here doing? They're cutting back, or propose to cut back, I guess it may not be happening, in the nursing program. That kind of mentality is one that I would say has no business being here. People who think in terms of cutting a program that's so vital to our health and well-being should be fired immediately. At least if I was in charge, that's what I would do. As I've stated, we all agree with the words coming from the leadership about protecting people's health and safety, but we demand actions to show that they are taking reasonable steps to protect the health and well-being of not just the City College community, but doing their part to protect the health of the world's community. Certainly, they don't have a magic bullet to protect everyone's health, but they should be taking reasonable steps that we're demanding that they do right away. And failing to do so is failing us. And like I said, a reasonable step is put up signs around the school. You have a masking requirement. Well, put up signs telling people that before they enter the campus. There aren't that many entry points. So thanks. And maybe Steve didn't mention it. Certainly we could stay after everyone's talked and answer any questions that people might have. But thank you.
Thank you, Rick. Yeah, I mean, for all the resolutions they pass, if there's no signs, as Rick said, on the campus saying there's a mask requirement and that people should get vaccinated, what does that mean? It means you don't know about it. So that's a real question. Do they want people to know about it? Are they concerned about the students and faculty and staff that may get sick? One other point I would add is it's not just a vaccine. It's not just a vaccine. It's a question of public health. What does that mean? That means public health, so people are educated, and also, I believe there should be a zero COVID agenda. The way we're going to suppress COVID is to shut it down as they've done in other countries. They've actually shut COVID down, and they've done that by quarantining and testing everyone. So one of the issues that we need to address is, why has there not been an industrial hygienist, a safety engineer, educating people about what the real issues are? And as we know, faculty have reported that rooms have not been properly protected. There's mold, the windows don't open, and this is a school that's gotten $51 million. $51 million from the federal government and state governments for COVID protection. Where has that money gone? People have asked the administrators, where's the money gone? No answer. Well, with $51 million, the least you could do was put up signs around about having masks. It doesn't require a lot of money to do that. That hasn't been done. So our next speaker is a safety engineer, and he's not speaking for Cal-OSHA, but he's a safety engineer there and is very concerned about protecting the health and safety of workers and the community. So welcome Charles Rackless, who's a member of the United Front Committee for Labor Party and CWG, Communist Workers Group. Welcome, Charles.
Thank you, Steve. Welcome, co-workers, friends, sisters and brothers, comrades. I've been an industrial hygienist and a safety engineer for the last 18 years. What we deal with are things that can't be seen, that need to be identified, and measures need to be taken to protect people who are near them, in particular in the work site. I've worked at the California Department of Public Health and at Cal-OSHA currently, and as Steve said, I do not speak on behalf of either of these institutions. If I did, I'd probably get fired, and I'd rather retire. So I want to speak both in my professional capacity and in my political capacity. As Steve mentioned, I'm a supporter of the United Front Committee for a Labor Party, because we need a workers' party in the United States, because we have two capitalist parties and we don't have any representation of the working class in any governing bodies in the United States. And I'm a member of the Communist Workers Group because I believe that we need a socialist revolution to deal with the triple-headed crisis of world capitalism, the terminal crisis of the economic system, the COVID crisis, and the environmental crisis all coming together. So first I want to talk a little bit about my professional side, and I appreciate that we talked about N95s earlier, and that's a very important issue because we hear masking, masking, masking. And what I've got here is a level 2 mask. This will not protect a worker or a wearer from COVID-19. The reason to wear this is to stop the spittle that presumably is what carries the COVID-19 to someone within 6 feet. So if we get back to what happened at the beginning of the identification of COVID in March 2020. At first, before March, in January, February, the CDC identified it as a novel virus, meaning a virus that's newly identified. They don't know the characteristics of it. During a period that something is a novel virus, when they don't know what the characteristics are, the universal precautions should kick in. In California, Cal-OSHA has a standard called the Aerosol Transmissible Disease Standard 5199, which identifies novel viruses as requiring the universal precautions, meaning an N95 respirator. For the workers who are exposed to patients with it. Quickly, the CDC backed off from the understanding that this is airborne transmission and redefined it as droplet transmission and contact transmission. That's very important because by doing that, they basically said, you don't need an N95 to treat a COVID patient. You don't need a higher level of respiratory protection to treat a COVID patient. Indeed, these level 2s were what people were told, or surgical masks were told they could use to treat a COVID patient. And the nurses were in an uproar because they understood it. They read 5199. They know what airborne transmission is. And they went out on the streets, and especially after one of their nurses died over there in Oakland at Sutter, they went out on the streets and demanded N95s. Now, how come they didn't have N95s, and why did the CDC back off on what was the actual science? Now, this is probably conjecture, but I think my conjecture is correct, because what they've done is they've outsourced production across the planet to just-in-time production, and they've put the production of these N95s over into China to one, drive down wages, and two, because it's more profitable for them to be able to do it over there and then bring them in here. Well, that worked out just fine until they had the crisis. Did they have a stockpile? They had a few million in stockpile, but they didn't break them out, and they had them in stockpile for years. So the issue with an N95 also is that it has to be fitted to you, and it won't fit to someone with a beard. I don't go inside with other people, so I have a beard. I'm outside. But the point is, an N95 is only as good as being fit tested for you. So we talk about that aspect. They backed off in March and said, oh, it's droplet precautions, which means this type of mask. Droplet precautions and contact precautions. That was a backtrack. It was a concession to the big bosses. It was a concession to the fact that they couldn't provide the N95s. Well, not that they couldn't have. I do recall, and some of us look like we might be old enough to actually recall, but I recall it from history lessons, that after the bombing of Pearl Harbor, they were rolling ships out of Richmond, California in a few days to start World War II. How come they couldn't retool a couple of factories and start producing N95s in the United States within a few days, a few weeks, a few months? It went on for months and months and months, almost 6 or 8 months until the shortage was over. Then the science was piling on, saying this is airborne transmission. And eventually, the CDC had to turn around and say that it's airborne transmission. There's still issues with distribution of masks, but that's a whole nother discussion. So I want to applaud everyone who understands the need to wear an N95. I'm not in favor of masking. I'm in favor of N95s for anybody who has to go into a room together, because we don't know for at least 2 days if I'm contagious. If I had a test 2 days ago, I don't know. Did I pick it up in the last 2 days? How many people are being tested? We've had that addressed before. So I want to get on to the other aspect of industrial hygiene, because before we get to masking, which is supposed to be the last thing, that's called personal protective equipment, and it's the last thing in what industrial hygienists call the hierarchy of controls. First, we start by eliminating the hazard. Then we engineer the hazard away. And then last thing, if we can't engineer the hazard away or eliminate the hazardous material, we put on an N95 or a proper respiratory protection or PPE, whatever it is. So what should we be doing? We should be engineering the issue away, and that's a question of ventilation and enough airflow. So let me get back to 5199, where they define what the airflow is supposed to be in a airborne infection isolation room. Those are the rooms that prior to COVID they put people with measles or tuberculosis in, so the nurses could go through an ante-room, don their PPE, go into the room, treat the person, then come out of the ante-room, take their PPE off in the ante-room, and then go back out and not infect anybody because they were clean going in, clean coming out. Those rooms got filled up real quick during the COVID crisis. So you had that issue. But let's talk about ventilation, because that's what's going to happen here, and that's what's happening at all the schools where they're having us go in. So the airborne infection isolation rooms are required to have 12 air changes an hour. That's 1 air change every 5 minutes, right? So that's a lot of airflow. That means you've got to have fans that can pull that. That means they have to be tested on a regular basis. There's a maintenance schedule. All of that is how they protect the nurses who are supposed to go into those rooms. And not only do they have that airflow, but they also have the PPE on top of that. So those are 2 types of controls to protect someone from tuberculosis or measles, which are airborne infectious diseases. COVID is an airborne infectious disease. It's not being treated that way in our hospitals. They're put in regular patient rooms with up to 6 air changes an hour, and the nurses are changing their PPE outside the rooms, not in ante-rooms, because the ante-rooms don't exist, because there's only 2 airborne infection isolation rooms per floor in most of the modern hospitals. So maybe we have an understanding there of why this was spreading. Okay? Now we get to a place like this. Do they have a requirement for 12 air changes per hour? No. Are some of the windows painted shut over the years? Maybe yes. What is the airflow that's being directed through the roof? I don't know. I don't work here. But there's stationary engineers that work here. There's facility management people here that work here. And they've had 1.5 years to work on that. They should have that right in front of them. They should understand completely what the airflow is and what's the need to do that. So that's from a professional point of view. I hope I've given you some information that's useful to understand how this goes. And then from a political point of view and the position of the Communist Workers' Party on reopening. We feel that reopening should be done only under workers' control. The working class needs to have its finger on the reopening process. We need to be able to identify and look at the spreadsheets of the airflow. We need to understand what type of masks and what kind of protection we have. We need to know if the person next to us is vaccinated and if they've been regularly tested or not. We need to know these things, identify them in every workplace, in every school, and every place before we allow them to make us come back to work. And the reason they want to make us come back to work, and the capitalist class has been driving to get us back to work since the initial lockdown and shutdown, is because of profits. There's nothing except for that. That's the reason that they want us back, and they don't give a hoot about your life. And they've proved that 1,000 times in 1,000 different ways. So I appreciate being asked to come speak here, and I hope everyone can bring this information out further. I hope everyone can go online and upgrade their mask wearing to N95s. You can't necessarily get fit tested without an industrial hygienist or a trained fit tester, but it will up your game. And you can pass that information, and indeed, if I go inside with anybody that I don't know, I will shave and wear an N95. Thank you very much.
And I think it's important that we get this information out widely, because it has not been presented, as far as I know, to anyone on this campus. This is a life and death question for the protection of the students, the faculty, and the staff. So our next speaker came over from the East Bay. His name is John Holmes. He's an executive board member of the Peralta Federation of Teachers. Welcome, John.
Thanks, Steve. Just a couple of things. Over at Peralta, we have exactly the same issues as at CCSF. Exactly the same issues. Unlike CCSF, Peralta has gone for the mask mandate and say, well, at least saying that everyone should be vaccinated. What they haven't done. The thing about a vaccination for a mandate for vaccination is you've got to make it possible for the students and the faculty to get vaccinated. That means having people on staff at the door saying, "You're not vaccinated, come here, we're going to vaccinate you." That's what's needed. You know, without that, a vaccination mandate is one more tool probably for discriminating against black and minority students. That's what you have to have. And I absolutely agree with the guy, with the previous speaker about workers' control. And by the way, that's not some sort of pie in the sky dream. The Hollywood unions, SAG and AFTRA, have negotiated with their employers a full set of pretty damn good controls over COVID, and they got that right in their contract. So absolutely it can be done by our unions if they stand up. And by the way, as to ventilation, we have exactly the same issue at Peralta. In fact, I got reelected. The guy who was running against me for reelection works in the labs at Berkeley Community College, and he told me that the chem labs that he worked in are so badly ventilated they had problems with the question of whether they could be open or not before COVID. And they've done nothing about it. And I recently heard from another executive council member that they have serious ventilation issue at Laney College. And the people who should be able to decide what's safe and what's not are the stationary engineers. They know that a hell of a lot better. They know that a hell of a lot better than any government officers worrying about profits for business. Okay? So workers' control of the whole process is absolutely what is needed. And one thing I will say is that I'm very glad, in fact, despite this, the colleges are reopening, because every second the colleges are kept down to online classes is discrimination against black and poor students who are simply not able. There's the digital divide, and I know personally in my own college, as I got shoved onto teaching history online, and as soon as that happened, the enrollments went down, and the enrollment got a hell of a lot wider, and that was before COVID. Now it's worse. Okay, it's reopening is absolutely necessary, but it has to be done under absolutely safe conditions. And the only way to get that is exactly like the guy said, workers' control. We need to have control by the faculty, the staff, especially the blue-collar unions, who are the ones who really understand ventilation, and input from the parents, and here at the colleges, the students too. That's what I stand for, and we're going into negotiations for our next contract next year. And the last thing I want to say is that before COVID, the main issue we were facing was equal pay for part-timers. I represent the part-time freeway flyers at the four colleges. And the main issue, in fact, the only issue that the union raised, which I was critical of, was equal pay for part-timers. I sort of felt like with the massive layoffs going on, equal pay for part-timers is great, but a lot better if you have a job than if you don't, right? But in any case, as a result of the fact that we were seriously agitating for strike action and had rallies and were seriously threatening strike action, we got it. Of course, that's easier at Peralta and other places, given that Peralta has the lowest pay rate for full-timers of all 72 community college systems in California, and so had less of a gap, so it didn't actually cost them a whole lot of money. But the fact remains, we only got that because we were pushing for strike action, and we were seriously agitating for strike action. So that's what we need to do. And that's one other advantage of reopening the college. It's a hell of a lot easier to organize the strike when you don't have a lockdown.
Michael Lyon.
Hi, I'm Michael Lyon. I was a part-time teacher of physiology to health students and nurses during the 1970s, right up in that building there. And my son is currently an emergency room nurse at Kaiser in Oakland. And he would come home crying of seeing people dying right in the emergency room from COVID. It's a very serious business. I think that what we've heard up to now makes it very clear that from the very top of CDC all the way down to City College and its lousy ventilation systems, you can see that there is a concerted lack of concern for the working class, dismissal of the working class. And that should be obvious from everything we've heard up to now, which I won't repeat. It's been great testimony. But the question is, so we know that all these unspeakable evils have to do with capitalism. The question is, can we overcome it? Can we unseat capitalism? Can we have a communist revolution? My belief is that in struggles like this one, that if we talk not only about the lousy ventilation, the fact that the October 1st date for vaccinations is 3 months too late to be effective for incoming students. In addition to talking about those issues, we have to talk about how the only permanent way to get to solve these problems is by workers' control, and that is going to involve a revolution. There's no two ways about it. It's not going to be handed to us. We're not going to be able to vote it in. We need a revolution. I'm from Progressive Labor Party, and I say that we can build such a revolution. We have newspapers here, Challenge, and we also have a leaflet about why the City College issue is a class issue and has to be fought on a class basis. Thank you.
Thank you, Michael.
Rick Baum, I'm a member of AFT 2121. And we had a Flex Day meeting on Friday, and guess what? We didn't talk about COVID. There's no discussion taking place, which is mind-boggling. I wrote to my union leadership a couple months ago saying, hey, there's this big problem here. What are you going to do? And I got back just a vague letter from one union officer, but that's it. We've never had opportunities to discuss what we want, what we think should happen. And so one reason why HEAT exists is because, unfortunately, I believe very much in unions. Our unions missing in action. And once again, we're seeing this here. They have not called for anything specific like HEAT is calling for, like a vaccine mandate, as an example. So I want to bring that to people's attention, that it's not just the administration that's failing us, it's not just the Board of Trustees, it's not just the state chancellor and many other institutions, but it's our own organizations that are supposed to be representing the health and safety of workers, and they're missing in action. And they aren't even talking about what are we going to do if we don't have a safe workplace. And I don't know all the rules concerning unions, but I always thought that one of the things they're supposed to be here for is make sure workers have health and safety. And you would think that if there's of all the issues, this would be one that they'd be on top of on a daily basis, making sure that we're going to have a safe health place. But then, as you may well know, we have a two-tier contract. This is true across much of the world, with the exception of some colleges in British Columbia, especially the Vancouver Community College. And so what's been happening at City College is that in our two-tier contract, it's like two tiers between full-time faculty and part-time faculty. Part-time faculty are paid significantly less. We lack the benefits of full-time faculty members and many other indignities, one of which is job insecurity. And though part-timers are members of the union, they pay dues, hundreds of them at City College have been losing their jobs. So in the last year and a half alone, well, last year 250 lost their jobs out of about 750. For this term, there's about another 70 that will be losing their jobs. And again, the union will say, we can't do much about that. It's the prerogative of the administration. So not only is our health and safety being compromised, but our jobs. So thanks.
Okay, thank you, Rick. And I wanted to also announce that he is planning to have a press conference action at the Museum of Modern Art on August the 30th at 4 p.m. because during this COVID, there's construction going on, but one construction thing that's not going on is the Performing Arts Education Theater, which center should be across the street. And we just passed in San Francisco an $845 million bond. When we're laying off teachers, we're closing programs, we're closing campuses. What is that $845 million going to go for, if not the construction of that theater and education center? And if that is not built, which is likely on time, then the mural at the Diego Rivera mural, which belongs to City College, will not go back to City College. It will have to be held in storage at $50,000 a month. So that $50,000 a month is a lot of money. That would mean students getting more classes and a lot more things. So we're going to have a press conference and rally at the Museum of Modern Art on Monday the 30th at 4 p.m. We invite everyone to participate and demand that that construction starts so the theater can be built. So I want to thank you all for joining us in this event. Thank you very much. Solidarity, and let's have health and safety for the students, faculty, and staff. Thank you, brothers and sisters.